Okay, so this is the first video in the series which we started, processing pages 1% better together, in which we'll develop a habit of reading on daily basis, almost daily basis. Whatever I will read, I'll share with you so that you also understand that how to read textbooks and how to develop a habit of reading which will increase our memory, sharpen our memory, which will increase our recall power, and it has a lot of benefits which you will realize when we do that. So right now I have started reading how to review clinical papers, how to understand them, which is a one section which most of the students feel difficult. How to read the paper? They usually read just the abstracts, the question like that, and they come to the conclusion. But how to dissect that paper is a little bit challenging for them when they are new. So still I feel it difficult at times, but now I'm trying to master it together with you and learn with you, so that we, after when we complete these sessions or complete reading this whole session, we are able to make some sense of the paper by ourselves, which will be helpful in discussions which you take place in your academic environment. So previously also I have tried this, but I was not getting the proper approach. So whenever we start from starting to end, we lost somewhere in between. We always stuck up at some point, we don't move ahead. So this time we'll start from the place where I feel it difficult or I feel appropriate, so that we should start from that section and then we go ahead. So okay, so this was about the intro. I'll not repeat it. Now, whenever we read a paper, the first thing which you after we'll see how to read abstract and questions and all those things. Right now we'll go to the methodology or the medical statistics section where we should focus how to make sense of it. So the first thing in any paper you need to understand when you are doing this research, then you are reading the methodology, is which type of data the paper has used and what type of data is distribution it is. So we'll understand. Data means at the starting of any paper, usually you get a table like this. You get some table like this, which is called as a baseline table, where the clinical population, where the geographical population, age, sex, gender, or the clinical data, the pain score, and all other things must be given. So by looking at it, you need to identify which type of data it is and how it is distributed. So in any clinical paper, there are usually 4 types of data in 2 sections. So the first is the categorical data and the other is the metric data. The categorical data is something which we can't technically measure, and the metric one is something which we can measure. So I'll give you example. First see the categorical data. So in category, firstly we have a nominal data. Nominal data means like gender. Okay, so it is male, female, blood group, A positive, B positive, AB positive, O positive, like that. Type of cancer, lung cancer, gastrointestinal cancer, colon cancer, brain tumors, like that. Now you see one pattern in this data. It can be arranged in any way, like A positive, B positive, AB positive, O positive. It can be also B positive, AB positive, O positive, like that. Type of cancer can be lung cancer, GI cancer, tumors or brain tumors or pancreatic cancer, anyway, we can arrange it. So gender, male, female, female, male. So a data which cannot be measured and which can be arranged in any order. The order doesn't is important, means they can be arranged in any order. It is called as a nominal data. So categorical data, nominal, categorical data. Now there is another type of data which cannot be measured, but there is an order in it, like stages of cancer. Stage 0, stage 1, 2, 3, 4. 4 is the metastasis, 0 is the initial stage. But like other one, pain score. Pain score 0, 1, 2, 3, 4. 1 is the mild pain, then this more pain, and then excruciating pain, like that. Mild, moderate, severe category. Now you cannot arrange like in the stages of cancer 0, 3, 2, 4 like that. 0, 1, 2, 3, 4 you will arrange. You cannot arrange mild, severe, moderate like that. So you need to follow an order. Though the difference between the numbers 1, 2, 3, 4, you cannot actually measure. You cannot just assess. How you will assess it? Sorry. How will assess is by observation or judgment like that. Let me keep it a little far so that you get a feeling that there is a book. So it will give you a better thing. So in that, so the data which needs to be arranged in an order but cannot be measured is the categorical ordinal data. So in category, we cannot measure it, we can only assess it. But if we cannot arrange in an order, if we can arrange in any order, then it's a categorical nominal data. If we need to arrange in a particular order, then it is a categorical ordinal data. So clear about this? Now, the second one is metric data. Metric data is something which has a unit which can be measured. Now in it, suppose parity, number of births, number of mortalities. This is a data which there is only a number is there. 15 deaths, 20 birth, 20 birth took place. So although we can measure it, we know that 4 is 4, 5, 6 means there is a number which we can measure, but it is not a continuous one. It's just a value. So it's a metric, discrete data, counting. We can count that, like how many balloons are there, how many balloons are there. So there are 25 balloons. Or how many death took place, 25 death took place. How many childbirths we had, 20 births, like that. So this is a metric but discrete data. Now there is a other data which can be measured, but it is also continuous. Blood sugar levels, 60, 70, 80, 90, age, 0, 1, 2, 3, 4, 5, 6, like that. Weight of the patient, cholesterol values. So something which is a unit and which is a continuous one, so we call as a metric continuous data. So these are the only 4 types of data which are present. So categorical, second is metric. Categorical, if you cannot, if order is not important, you can arrange in any order, then it will be nominal. If you can if you have to arrange in an order, then it will be ordinal data. Then metric one, if you are just counting it, then it's discrete. If it is a continuous measured thing, then it will be continuous data, metric continuous data. So I'll give you example. Age of the patient, age. How to identify the data? So first thing you do is, can the data be arranged in an order? So age, yes, it can be arranged in an order, 2, 3, 4, 5, 6. We know that in like that. Does the data has a value or unit? Yes, years. Age has a years. So 4 year, 5 years. So it's a value which is arranged. So it's a metric continuous data. Now, first thing you ask whether it can be arranged in order. If it cannot be arranged if order is not important, then obviously it becomes a nominal data. Now, if it is a unit, then no unit is there, so it becomes ordinal data. Now, if it has a unit, whether it's a counting thing or whether it's a continuous thing. So counting thing will discrete, and measuring things becomes the continuous data. So example, age, unit is there, so obviously metric one. Continuous one because age is a number. Sex, gender, male, female. It can be female, male. We cannot there is order is not important, so it's a nominal data. Now, length of the hair, length of the hair, short, mid, long, and long. So we need to have a order, but the order don't have a value, so it's a ordinal data. Color of the hair, blonde, brown, red, dark. Again, blonde, brown, red, dark. No order is required. It can be anything, so it becomes a nominal data. Now, pruritus, or the live lice which is found in the hairs, 0 plus 2 plus 3 plus 4 plus. So plus, 2 plus, 3 plus, technically they are not number, they are just saying that we need to arrange in order. The 2 plus is higher than 1 plus, so it is ordinal data. So like that. So this type of tables are there, which are there in given in the text. Then by looking at that, you need to identify which type of data is there. Now second, after you assess the data, now again, why I'm telling you is why we are reading this data and type of data, type of distribution of the data, because based on this, we'll look at the central tendency and the spread of that central tendency. Based on that, we will use the statistical method to analyze the data. If we have identified the data wrongly, then we'll use the wrong method, so the paper will become flawed. So you need to identify which type of data we are dealing and the distribution of the data. Now, so distribution of data means shape of the data. Whether the data is spread uniformly, it can be one thing, it is spread uniformly, or if it is a normal distribution means bell shaped. Most of the values are in the bottom and it is a bell shaped curve, and slowly it is tapering at both the ends. So bell shaped is your normal distribution. Now suppose most of the values are arranged either in left direction or either in the right direction in one or second, then we call it skewed data. So if it is a counter clockwise thing, means it is going like this clockwise. So means if the most of the data is arranged in the initial part and it is going like this, the direction is going like this. Skewed data means like this, then we call it positively skewed data. If it is anti-clockwise, like means most of the values are arranged at the end of or extreme of this side, and the tail is going towards this side, we call is a negatively skewed data. You can this is the way of remembering. You can go to the Google and search positively skewed data and negatively skewed data. Why it is important? Because certain test or certain central tendency can be applied only if the data is normally distributed, and certain test and central tendency can only be applied in whether the data is skewed. So this is very, very important. Now, how do we identify that the data is which type of shape it is or skewed data is? So one thing is frequency histogram is there, number of bars are there. So you have values here on the x-axis and frequency on the y-axis. So histogram, frequency histogram, we can identify where the data is. I'll show you. See, in this, if the most of the data are arranged here and it is tapering like this, so it is tapering, so it is a positively skewed data. While this is in this, most of the data are arranged, this is a bell shaped, so it is normally distributed data. So this is data and shape of the data, and usually the authors provide this in the papers, and if they have not provided this thing, then you assume that it is a skewed data, they are playing safe, and then we need to see that what is the central tendency, which type of test they are applied. So this was all for today. What is the data type and the distribution type? The reason is, once we know the data and the distribution type, then we'll know on based on which we'll go to the central tendency and the spread of this data, and on basis of this we'll apply the statistical test which we need to be applied. So we'll cover in the next session, which I read, is what is the central tendency, which is mean, mode and median, and how is the spread, which is standard deviation or the interquartile range. We'll discuss in the next session of this series. I hope you people will like this series, and do let me know in the comments how do you find this useful, because this is something which I read and I'm trying to share with you in a very unfiltered manner. Thank you, and see you soon in the next session. Okay, bye.